Doctors, harness the power of AI to supercharge your diagnoses. Have you ever wondered how artificial intelligence can aid in clinical diagnoses? Will AI turn us all into the next Dr. Gregory House? A groundbreaking study published in Nature explores the potential of large language models, or LLMs, in improving medical diagnostics. You're watching Tech Talk, where we talk all things health tech. Researchers from NYU Langone and beyond theorize that LLMs could revolutionize the way clinical diagnoses are made. By leveraging their vast contextual knowledge and language processing capabilities, these models could assist healthcare professionals in a wide range of clinical scenarios. The study examined how LLMs can analyze large volumes of both structured and unstructured medical data, such as patient records and scientific literature, to provide valuable insights to doctors and improve accuracy in diagnosing various conditions. In this case, researchers used over 10 years of NYU Langone inpatient clinical notes, in other words, unstructured free text written by physicians. The LLM was pre-trained to learn medical context on a vast array of medical literature, including research papers, clinical guidelines, and standard procedures. This training equipped it with a comprehensive understanding of medical concepts and enabled it to identify patterns and relationships within patient data. When subsequently confronted with large volumes of unstructured data from the physician's notes, the LLM employed advanced natural language processing techniques to extract relevant information. It identified key data points such as symptoms, medical history, test results, and prior treatment approaches. Using natural language processing techniques, the LLM, called NYU-Tron, extracted relevant information from medical records, then analyzed this data to generate predictions about clinical outcomes. LLMs excel at analyzing unstructured text, such as physician's notes, radiology reports, and discharge summaries. By processing this textual data, NYU-Tron extracted crucial details and identified patterns that may contribute to accurate diagnoses and treatment plans. In this way, LLMs go beyond processing text. They even provide context. Interestingly, NYU-Tron outperformed the state-of-the-art large language models on 5 clinical tasks, including in-hospital mortality prediction, comorbidity onset, and readmission likelihood. Because they've absorbed such a vast amount of background medical knowledge, LLMs act as powerful predictive tools, allowing us to make informed decisions about future patient care. By examining patient data within the massive context that NYU-Tron provides, we can receive predictions on the likelihood of specific outcomes, such as disease progression, treatment response, or potential complications. LLMs have also demonstrated remarkable proficiency in analyzing imaging scans and laboratory results. LLMs can be coupled with radiology AI models that read images autonomously, such as the one published earlier this year in Radiology that boasts a 99.1 sensitivity rate on abnormal radiographs, in comparison to a 72.3% sensitivity for radiologist reports. Together, they can quickly identify patterns, anomalies, and potential correlations, aiding in the accurate interpretation of complex medical data. While LLMs offer immense potential, we must also address the ethical considerations surrounding their use. Transparency, privacy, and bias mitigation are crucial aspects that need careful attention to ensure responsible and equitable deployment. The integration of LLMs into clinical workflows has shown promising results across various medical specialties. In primary care, LLMs assist in accurate diagnosis by considering a broader range of potential conditions and providing evidence-based suggestions for treatment plans. Through their vast computational power, LLMs can recognize relationships and correlations within the data. They can identify associations between specific symptoms and diseases earlier than humans, detect risk factors that humans may think are noise, and highlight potential treatment approaches based on the analysis of millions of similar cases. In specialized fields such as radiology and pathology, LLMs augment medical experts by swiftly analyzing and interpreting imaging scans and lab results. Their ability to detect subtle patterns and abnormalities can help identify early-stage diseases and guide appropriate interventions. LLMs also contribute to the field of precision medicine By analyzing vast amounts of genomic data in the context of a patient's individual medical record, they can identify genetic markers and predict individual responses to specific treatments, enabling personalized therapeutic approaches for patients. What's more, AI-powered systems can continuously analyze patient data in real time, including how their genetics interact with the rest of their clinical risk factors. By integrating genetic testing results with other relevant health data such as wearable device information, electronic health records, insurance claims, and medical imaging, AI models can provide dynamic, actionable insights to healthcare providers. The wider omics field, including proteomics, the study of a patient's protein signatures, transcriptomics, the study of a patient's RNA transcripts, and metabolomics, the study of a patient's individual metabolism, are poised to provide an incredibly powerful singular dataset that data scientists will be able to use to model a patient's unique health state, one day even down to the molecular level. The analytical capabilities of LLMs, with their breadth of data inputs, will allow doctors to tackle complex cases and consider a broader range of potential diagnoses, not dissimilar to Dr. House's legendary abilities. They assist physicians in considering rare conditions or uncovering connections between symptoms and diseases that may have been overlooked. Isabel Healthcare is a great example of a differential diagnoses tool powered by AI that has documented examples of assisting doctors distinguish between more common and very rare cases. Beyond diagnosis, LLMs aid in clinical decision-making by providing evidence-based recommendations for treatment plans and monitoring strategies. This assists healthcare professionals in optimizing care for a patient's unique needs and improving their long-term outcomes. LLMs have the ability to not only recall, but also to contextualize clinical information by considering a patient's medical history, comorbidities, and tie them to relevant research findings. They can integrate data from a variety of sources and provide a holistic view of a patient's past trajectory. Furthermore, LLMs are valuable tools for medical researchers. They can efficiently sift through vast amounts of scientific literature, extracting relevant information and identifying emerging trends, ultimately accelerating the pace of medical discoveries. AI can also play a valuable role in accelerating the discovery and development of new drugs. By analyzing vast amounts of genetic and molecular data, AI algorithms can identify novel drug targets orders of magnitude faster than human researchers alone, automate the needle-in-a-haystack search for lead-like molecules, and help to predict the efficacy of different drug compounds based on an individual patient's genetic profile. This can help pharmaceutical companies like In Silico Medicine streamline the drug development process, making it more efficient and targeted. As technology advances and LLMs continue to evolve, we envision a future where these models collaborate seamlessly with healthcare professionals, offering real-time insights and decision support throughout the patient care journey. AI is coming to an EHR near you. Doximity has already added ChatGPT as a tool for physician note capture, and major healthcare companies are experimenting with additional tooling daily. The integration of large language models in clinical practice holds tremendous promise. Through their knowledge, analytical capabilities, and predictive power, LLMs have the potential to revolutionize healthcare, working alongside human healthcare providers to improve patient outcomes and advance medical discovery. You're watching Tech Talk Healthcare, where healthcare talks tech.